I think we're actually in a crisis with mental health.
We have seen in the past 5 years an increase of upwards of 200 to 300% in mental health calls.
We're seeing more and more patients in the emergency department, more and more patients reaching out for help.
The San Ramon Valley Fire Protection District is a special district, single purpose. We provide fire and EMS, emergency medical services, to the community as well as protecting property. We also are uniquely an ambulance provider. Every call we go on has a mental health aspect. And when I reflect on my career and I look at the calls I've gone on, it was so obvious the mental health crisis that my patients were going through and family members were going through, but I didn't see it like that 20, 30 years ago.
So my role as the emergency medicine physician and advisor and counsel is to help develop a program. Chief Meyer presented the issues that were going on in the community. He asked us to solve the problem, and we developed our fire first response. The traditional response with mental health calls was that police would respond to the call and fire would stage. However, we decided to reverse that and let the mental health professionals, healthcare providers respond to these calls first. So the paramedics respond first and now the police stage.
The Firefighter First program is designed to assist anybody that's experiencing a behavioral health emergency within the community. They call 911, our dispatchers triage the call that comes in, and then they're able to either transfer that call to the Warm Handoff 988 center or dispatch our fire and police resources to respond to provide whatever aid that person may need. From our understanding, this is a first of its kind program. And the reason it's a first of its kind program is because we take different aspects and we've been able to merge them together to create a more holistic approach to solving these emergencies.
And their biggest issue is they want to talk to someone. And since police and fire are responding to these mental health calls, let's put the firefighters who are healthcare providers, put them in front of the patient so they have someone to talk to. Hopefully we can de-escalate, get them the services they need, and avoid unnecessary psychiatric holds.
I can't take credit for the idea because the idea was coming from my firefighters and the families that we responded to on medical calls and mental health emergencies, a frustration level that we were responding to these calls and we only had one option. We could only do what the police officer told us to do. So we were taking kids as young as 8, 10 years old, and we were taking them to a psychological facility hospital, which really, to my firefighters, wasn't in the best interest of the child and sometimes the adults. And then it also, unfortunately, led to parents calling me up because we transport, and they would ask me, why would I do that to their child?
When we respond on scene for these firefighter first emergencies, 80% of those calls no longer result in an involuntary hold to county psychiatric emergency services. That's a big deal for those patients. We know that when we transport somebody to county psychiatric emergency services, within 24 hours, 90% of them are being released. And they potentially aren't being released with the amount of care or the type of care that they need. So that's not always the best solution to take patients to that facility.
Firefighters are often seen as the most respected public servants, so having them show up builds the trust automatically because we know they carry the tools needed to provide support and resources and really have a more culturally responsive approach, meaning we see the individual who is in crisis as the primary person we need to support.
Firefighters have always been on the forefront. We've always had to deal with this issue of mental health. And it comes naturally in a lot of ways. And what we've tried to do here is leverage that engagement to our advantage in dealing with the changing times of more mental health crisis.
We get calls from family members who are so excited about what's happening here in San Ramon because it's kind of embarrassing to have police show up at your home, and the stigma that it creates, it's really diminished that for the family members, especially when it's children having police show up and individuals seeing them sometime handcuffed and taken away versus having a truck show up followed by an EMT when it's needed. But more often than not, it's just a conversation. And through that conversation, healing begins.
What makes this program so unique and so effective is that our firefighters are able to get on scene first and provide medical care to the patients that are calling 911, I think in a way in which hasn't been done before. We're viewing these as medical emergencies, not as police incidents.
We're very focused on the community's needs. We know the ups and downs that a community is going through because our constituents and our fire board members, they have their finger on the pulse. And being a single purpose, focused district, it allows us to really be more intimately involved with the community and the things that we do.
And we're able to efficiently and effectively provide a solution to something to this specific issue that we think has been a problem for a long time.
When you're in a special district, you have a fire board focused on the mission. And the one thing in public service is if you're focused on the mission, you get things done.